I think when we look at new patients and newly diagnosed, I think an in-person visit is certainly advantageous. I think people certainly want to meet their doctor in person. What I've found personally is after that initial visit, then we'll convert the rest of the visits by telemedicine. If the patient is willing, if they want to come in, I'm happy to have them come in. Where I think it's really beneficial is in survivorship. After the patient has gone through treatment, and she may still be following with her medical oncologist because she's on hormonal therapy, or she may be on some form of chemotherapy. And maybe she wants for me to be able to take a look at her mammogram. Well, I can still do that because I can remotely access those films. And then we could do that televisit. And if she's not expressing any concerns, then we can do that as a televisit. So this helps, especially for those patients in survivorship, where they're not going to 3 and 4 different doctors on a regular basis. They're going to that one doctor, they're getting that in-person visit, and then some of the other providers are part of the team can maybe move theirs to telemedicine visits. So again, I think it helps to keep patients with that connection to some of those providers without, again, having the burden of taking time off from work, having to arrange childcare. They can do those other visits by telemedicine. So, and that's something new that we weren't doing pre-COVID. Patients were having to come into the office and see every single provider for every 6 months for the first 2 to 3 years after their diagnosis. So I think that really has made it more convenient for the patients. And it's really allowed us to really streamline our operations on the provider side, which then allows us to be able to serve more patients.